Hey guys, this is Dr. Leslie again with our next segment of videos. If you haven't seen any other videos, I give pretty much the same disclaimer. These videos are just a new tool that I'm trying to use now to supplement some of your PowerPoints. So if you're kind of getting tired of reading PowerPoints, looking at slides, looking at other YouTube videos, I'm trying to put something else together that will go over most of the information, but I'm trying to keep these videos try not to make it in a robotic way. So I'm not following notes as I'm doing it. So if I do miss a landmark or two, please cross-reference it with everything you need to know from the PowerPoints as well as any of the palpation sheets I gave you for the practical exam. As time goes on, I may be replacing some of these videos as my technology increases. Well, ending the legal disclaimers, let's get into the proximal femur. So what we're looking at here is the proximal third of the left femur. All right, so over here where my pen is now, the point of the pen is going to be the medial side. Obviously, if we came up, we'd be closer to the pubic bone, pubic symphysis. This is going to be the head of the femur. Now, this is going to articulate with the acetabulum. All right, now we learned the acetabulum in the pelvic video, which I still have yet to do at this moment. Remember, that's a combination of the pubic bone, the ischial bone, and the iliac bone, and it forms that ball and socket joint, okay, or the diarthrodial joint that we have in the hip. Now, remember when we compared it to the shoulder, which is kind of like a golf ball sitting on a tee, we have a lot of mobility, but not as much stability. In the hip joint, we have a lot more stability, but a little bit less mobility. Okay, so this area, the head of the femur, is going to articulate with the acetabulum and form that classic ball and socket joint. Then we're going to have the neck of the femur. Okay, we're looking anterior. So this is out here is going to be your greater trochanter. If you palpate the lateral part of your thigh right now as we're doing this video, and you internally and externally rotate your leg, in layman's terms, twist it in, twist it out, okay, you will feel the greater trochanter kind of protruding out into your palm of your hand or fingers or whatever you're using. Very important landmark because there are going to be a bunch of muscles that are going to attach to this area. When I turn us over to the posterior side, I'll probably review some more of those muscles. But one thing I should mention is the IT band, okay, which will be a band that will pretty much start up at your iliac crest superiorly, come down, almost how my marker is now, going over the greater trochanter and kind of continuing down to the knee, okay, in the lower section. Common friction point. Some people believe there's IT band syndrome, typically in 3 different locations, either at the knee, mid-thigh, or up around this greater trochanter. We have a bursa here, common spot for bursitis, IT band syndrome, because of the frictioning of the muscle. And in women, due to the changes in the pelvis, a little bit more susceptible. But again, not a condition that men are immune to, just maybe not as common as women. So our greater trochanter, again, anterior, and then we're going to have our lesser trochanter, more on the medial side. That's where the psoas major, iliacus, 2 of our hip flexors are going to attach to. So you can imagine if that's pulling up like a rope in this direction, okay, you're going to have hip flexion. All right, so one other thing, we don't see it here, so I'm not even going to try to turn it around. The fovea capitis is going to be almost centered on the head of the femur. That's where the ligament of teres is. Some blood circulation, blood supply is going to get into the hip. In the lecture, I usually talk about Bo Jackson's hip, NFL player back in the 80s, dislocated his hip, it reduced, it damaged the blood supply here near the fovea capitis, and he got necrosis or wasting away the bone. I'll talk more about that in the lecture. Here's the shaft. Let me kind of zoom out here a little bit if I have a little bit more space to do that. Remember, the shaft of the bone is going to be the diaphysis, the highly metabolic area, the metaphysis, and then you're going to have the epiphysis on the end of all long bones. If I rotate my hip to the posterior side, okay, one thing, what we're going to do, I'm going to zoom in here a little bit. Now, let's just go over the things we've said. We said this was the head, the neck. We've got the greater trochanter. We're looking a little bit more on the posterior side. We're going to have the lesser trochanter. Then we're going to have the intertrochanteric crest that runs between both trochanters, hence intertrochanteric crest. We're going to have the gluteal tuberosity, where gluteus maximus is going to attach to. You don't see it that prominent here on this because, again, keep in mind this is plastic. And on the posterior side, you're going to have the linea aspera. If I zoom out a little bit, okay, we'll catch a little, but the linea aspera running up down the posterior side. For muscle attachments, it's kind of a roughened and real bone, and some of the adductor muscles, those quote-unquote groin muscles that we'll cover in class, attached there. Things to note too. So if we're looking posteriorly, and when you do a practical exam, and a lot of times we'll throw the pictures up of the muscles, look for this intertrochanteric crest, okay, for knowing that we're looking posteriorly. If we turn it back over, if I rotate it around and move the camera a little bit so you can kind of see how there is a crest there. Okay, it's not smooth like the anterior side, so let me kind of put this down. Hopefully this works. Things to notice with the greater trochanter, I told you, is the glutes, glute medius and minimus, are going to attach. Remember, those are strong abductors of the hip. Remember, don't be confused with gluteus maximus, was a strong extender that's going to go down to the IT band and the gluteal tuberosity, but glute medius and minimus. So if you can find the greater trochanter, you know the glute medius and minimus are on the posterior lateral portion of the glute. That's going to come down here. The piriformis is going to come around from the sacrum, again, go through the middle part of the buttock and attach to the greater trochanter. You're going to have the gemellis, the go-go muscle, the gemellis, the obturators are going to come across. Again, this is the left hip from the posterior side. So over here, okay, is going to be medial, okay, closer central to the buttock area. And you're going to get your go-go muscles are going to attach about right here off of the back of the greater trochanter, okay, or the trochanteric line, intertrochanteric crest. And then again, here is the lesser trochanter, specifically for the psoas major and iliacus. Okay. So again, hopefully that clears up a little bit of the proximal femur. Please do use this with your handouts. Again, I'll probably always end these videos before and after, so you don't feel I'm covering everything. I'd rather not be looking at all lists. But I think I am being pretty thorough with most locations on the notes. Okay? Thanks, guys. Hopefully this was helpful. Take care.